Good morning, everyone. Good day, good evening, wherever you are in the world listening to us today. My name is Ben Blanquera, and welcome to CDO Magazine. I'm with Rackspace Technology, a leading provider of hybrid cloud and AI services for firms in the data analytics and AI modernization journey. This year, we're speaking to leaders across the globe, talk about their experiences with AI with Dr. Dominik Nowak, President of the Ontario Medical Association. Welcome, Dominic.
It's such a pleasure to be here with you, Ben.
I'm sure if you talked with your organization, like what are some specific applications or things that you can see AI can solve that is happening right now?
Yeah, and Ben, you're right. It's better patient care when we take that 19 hours per week off the plates of doctors. It's joy in work, so restoring joy in work to medical practice. And then it's also access to care, so getting people the care that they need versus right now the situation where doctors are being drawn to the administration and the bureaucracy of the healthcare system. And the big application that's already here is something
Yeah.
called AI Scribe. Right.
Okay.
So you imagine a world where you walk into your doctor's office. In a
Hmm.
regular world, your doctor's attention might be actually be split with either their paper notes, sometimes or most often their computer, right? Because they
Hmm.
be taking notes to remember some of the things that go on in the visit, and then
Hmm.
also have thorough documentation around what happened during the visit, the things that you discussed, the decisions that you made together, and
Hmm.
technologies like AI Scribe basically have in a privacy conscious way a computer listening into the conversation and creating a note from that. And that note will include everything that the doc needs from a medical legal perspective in terms of documentation and history and for review later on. But then also, what decisions did you make? What were the conversations that you had during that visit? And then what are some of those things that they might want to share with you after the visit that would be helpful for you in your health?
And that's got to be groundbreaking for some of these docs to not have to do that. I'm curious, where are you at? What stage is this technology? Is it pilot production or where are you at with this?
It's ready. It's ready
It's
for work
ready.
in healthcare. It's already being used by many doctors in our province. If you asked me a few months ago, maybe you'd have occasionally doctors raising their hands who are using it. We're at this tipping point right now where right now maybe 1 in 2 out of 10 doctors in Ontario are already using AI scribe technology in some way to help them with patient care. And it goes back to those three things that you mentioned earlier. Better care for more people, that's
Mhm.
more joyful for doctors because we get to focus on the patient care rather than the documentation time and the administrative burden.
Oh my goodness. I love sort of like I have this tagline in my brain, AI for joy and health now. It's sort of
Yeah.
like resonating through my brain. I'm
Yeah,
curious. Go ahead, Dominic.
and listen, it's if you end up using something that takes the administrative burden off your plate as a doctor, doctors are saying that they can be better doctors, they can be more responsive to their patients, and it's more joyful for them because they get to focus on what they signed up to do, which is the patient care rather than the bureaucracy.
Oh my goodness. That's got to be like could be life changing for many of these folks. When there is risk associated using AI. I'm just curious. How do docs look at the risk associated with something not hearing correctly, something not putting notes? Like, I'm just curious. How do you managing the risk side of implementing this?
Yeah, and I'd say doctors are very careful and have it as a priority to make sure that anything that goes into the medical record is done with care because it does have an impact on patients and
Sure.
patient care in terms of the the type of planning that we do going forward, the decisions that we make for treatment in the future. If
Hmm.
another doctor sees you as a patient and reviews that previous note, then some of the visit might be influenced by some of the ideas, the plans, everything like that were in that previous note. So it's still important that doctors are reviewing the notes
Hmm.
afterwards that are generated by AI, but it takes that initial cognitive load that right now we as doctors are doing during the visit, after the visit, or usually actually in the evenings after that entire busy day. It's taking that cognitive load off the plates of doctors and letting us focus on the care.
That's amazing. I'm not a doc, but I use AI notes in every one of my meeting, and it has shifted, like you said, my cognitive load from writing it down and documenting to more actively listening and
Yeah.
participating. And
And
it's yeah.
we know that relationships make the difference in healthcare. People
Hmm.
who have a consistent, trusting relationship with their family doctor or their specialist and having better care, fewer emergency department visits, fewer hospitalizations, they end up costing the healthcare system less money. Those relationships actually matter. So just like you said, Ben, in meetings, that it helps you build relationships rather than focusing on the
Yeah.
documentation. The fact that this lets us focus our cognitive load on building the relationship and doing medical care, that actually is a matter of life and death in healthcare.
Yeah, there are no higher stakes than what you all are doing in these patient visits. I'm curious. So you said this is commercially available now. Is this literally they buy the service and they implement it,
Yeah,
and
what
you
we're
can
seeing,
just
yeah, we're seeing several different options for doctors, and what we're doing at the Ontario Medical Association and Ontario MD, which is a subsidiary of the Ontario Medical Association, is we're making sure that the opportunities, the options available to doctors, to clinics, are grounded in good care, that they have good follow through support. We're looking at the type of customer service that they have, and that our
okay,
doctors are happy with the solutions that are coming in,
okay,
so
okay.
that they could give the best care possible. So that's some
So
of our advocacy work that's happening behind the scenes right now.
yeah, well, it's got to be a huge source. So you're vetting out some of these things and presenting them to the docs.
Yeah, that's one way of thinking about it. So that, when doctors are coming up with which of these types of opportunities they want to take on for their clinics, for their
Hmm.
patients, for their communities, we'd give them an idea of what are the pros and cons, what are the types of things they should be
Right.
watching out for. Are there any special privacy related questions or other legal
Mm,
requirements that they should be asking if they're going ahead as early adopters? And
mm.
what are those ideas that they should be thinking about to make sure that they could get the most out of these technologies for their patients?
That's fantastic. That's fantastic. Dominic, we talked about another application, perhaps for AI, called auto referral. Can you share a little bit? What is the problem there?
Yeah, I think of centralized referrals as one of the big frontiers in challenging in tackling the administrative burden in healthcare. Right
Hmm.
now, we have a system where essentially, if you first of all, the Canadian healthcare system relies on primary care or family doctors as that front door to the
Hmm.
healthcare system. So most of the time, if you need added care, if you need to go to the specialist, or if you need imaging like an MRI or any other type of care, you have to go through your family doctor. And
Okay.
what that means is family doctors are sending referrals, right? And sending requisitions for MRIs and imaging and
Hmm.
doing this kind of work behind the scenes. And that's a
Hmm.
big part of the 19 hours of unnecessary bureaucracy and red tape that we face per week in Canadian healthcare for doctors. And
Hmm.
that's because it's actually challenging sometimes to get referrals. I think of the example I had a few months ago that comes up very often in clinic. We needed a referral urgently for someone. Over
Hmm.
9 months or so, I sent four different referrals to different specialists and hospitals. We
Hmm.
eventually got someone for this patient to see that patient, but it took almost a year, and it took
Oh
so
my
many
God.
different faxes, phone calls, all of these different this chasing down advocacy that I had to do as their family doctor. And imagine the patient experience of this. They're
Oh.
waiting. They don't know when that visit is going to be. They don't know who's going to see them. They don't know why their referral is being declined
Hmm.
by the referral recipients, the hospitals, the specialists. They're often good
Right.
reasons, but the patient doesn't know why. And imagine a world where you sit down with your doctor. Let's say you need an MRI or a
Hmm.
specialist visit, and you say, maybe you could drive up to 100 kilometers, or maybe
Hmm.
you rely on public transit. Maybe you have family that lives in the next big city or in another community, but you live in and work in one city. Maybe you could list that. Maybe you want a specific hospital or a specific specialist. Maybe you just want the first available visit, and then you could list the urgency and you send it off, and your family doctor can send it and then forget about it, but you can track it on your phone as easily as a pizza order, right? And you can make sure to stay up to date on it. And you see when is that referral accepted? Who's it assigned to? When's your first visit? Maybe reschedule that visit and so on. All of that is called centralized referrals for, let's say, a world where every referral has that
Mhm.
kind of approach. And that could be another big frontier for AI in terms of doing that matching between referrals and specialists, hospitals, and imaging.
Oh my goodness. It's fascinating. You gave the analogy like I can track my pizza
Yeah,
where it's at. How come I can't track my medical referrals and the things that are really, really important? Thank you so much, Dominic, for your time. I appreciate you being on here today.
such a pleasure, Ben.